Welcome to Unpacked with Liat. Today I'm sitting with Abby Vidikan, also known as LA Midwife Abby. She is an incredible midwife who specializes in home birth, women's health care. And I wanted her to come on here and kind of give you guys insight into what home birth is, what the holistic, non-Western medicine can look like should you choose to go this route. So thank you, Abby, for coming.
Of course.
And just kind of give like a brief thing of like what it is you do in your practice.
Yeah. So I have been a midwife for just under 10 years now. I wasn't, being a midwife was not always my path. I didn't, wake up one day and I was like, oh, I'm going to be a midwife when I grow up. My life plan was actually entirely different. Went to USC, graduated, moved to Washington, D.C. because my goal was like, I want to work in politics. That's my dream. I was going to go to law school one day.
Very different paths.
Very different paths. But my aunt was a midwife.
Okay.
And so when I was a student at USC, whenever I would go visit her, I would go to her office. I would see the relationship that she would develop with women that, I think for any of us who've experienced like being in healthcare settings, it was so unique for me to see her clients like hug her and talk about how they were going to miss seeing her every week. You could clearly see that there was a bond that developed throughout the course of someone's pregnancy that I think was so different. So I knew then that when I got pregnant with my first, I was going to work with a midwife, that was the level of care and the level of compassion and kindness and that I wanted to experience when I was pregnant. So it was actually when I got pregnant with my first, working with a midwife, that I was kind of led down that initial path. And again, I had been exposed to it, but it was feeling that relationship and developing that relationship with someone that I was really looking to like usher me through what felt like just this very pivotal, life-changing time. And I was 36 weeks pregnant. I called up my aunt and I was like, I'm going to be a midwife.
Oh, wow.
And she was like, why don't you have the baby first? And then you can kind of decide. And I understood where she was going with that. I think that, dealing with like the rigors of on-call life is definitely challenging, but I have not looked back since.
Wow.
And I think that it was the exposure to my aunt, the midwife, and then obviously apprenticing under her and being her student and learning through her, but also having developed that relationship with my midwife that it in so many ways has shaped the type of care I provide to other women. I think also like I'm fortunate enough to have had 3 children of my own and to have walked that path many times, and then also been in labor, 3 times before. And that I think what I learned from each experience was that pregnancy and birth called on me differently each time. It needed something different for me each time. And each birth was so uniquely its own different experience that I never, when it comes to the care that I give women, that I'm so fortunate to have given women over the course of the last 9+ years, it's really that it's uniquely designed to work for everybody. So like when I'm so grateful that I get to walk this path with women, so many times over again. Some women come to me with their first, some women come to me with their fourth, but more often than not, it's like they come back the next time. And each pregnancy is so uniquely different. Each birth is so uniquely different. You can't show up and be the exact same midwife all the time.
No, because also not every baby comes out the same way.
Never.
They come out through the same area, but the way in which they come out and how, sometimes it's back labor, sometimes it's front labor, sometimes they're sunny side up or whatever.
Sometimes it's fast, sometimes it's long, sometimes they're bigger, sometimes they're smaller.
Exactly. And it all affects the body in different ways. But again, like going back to what you said earlier of having your 3 children, it gives you the in to understanding because again, no birth is the same. So you have these like 3 sort of like case studies, so to speak, of like personal experience to be able to say like, it's not going to be the same. And you're not just talking out of thin air, like you actually did it, you went through it and you know what that's like.
I think also on the other, so I've only experienced unmedicated births. I don't have a fear of the medical system. I'm in the medical system. I think that even though midwives had to provide holistic care, we also have tools, Western medicine tools that help keep a woman safe in an out-of-hospital environment. But I think what I learned through each birth is that there is an intuitive side of labor. There's something that is going on, an internal dialogue between a woman and her baby that is guiding her through that process. One that any outside observer, they can't exactly tap into it. And I remember my aunt said something. My aunt is my midwife. And she said something to me after my 3rd birth that she knew right before he was born, I tilted my hips to the left. And just based on like what she had watched over the course of the few hours that I was in labor, she said, I knew immediately that he was going to come out with a hand up.
Oh,
Because
wow.
what she saw was that I intuitively created space on that side that he needed the space on. And in the moment, I remember doing it. I remember feeling it, but I don't like, there wasn't a rationale to it. It's simply like, I think this is going to feel better. And so again, like when I think about how that birth shaped who the midwife that I was after that experience, it was like, I never doubt a woman's intuitive knowledge when it comes to her pregnancy, her birth. I look at us as midwives as people that you should be able to rely on to answer your questions and guide you through decision making and be that person that like you can lean on for support. But ultimately, what I want someone to gain through my practice is that you have so much intuitive knowledge. When it comes to your body, your baby, your birth experiences, like I will never doubt that knowledge. I want you to tap into
Western medicine tells you to doubt that knowledge. So coming from that and learning to shift that mindset of, I don't know what to do, versus like hearing, no, you know exactly what to do. And it's not something that I can coach you on. And it's going to happen in the moment and you're going to know what to do. It is going to be hard. It is going to be painful, but you will know what to do, is a hard thing to like grasp until you've actually done it. And then you're like, okay, I knew what to do. It was still hard. It still hurt like hell, but like I knew what to do. What is it that happens in Western medicine that doesn't necessarily happen with you? Like when a woman comes to you for OB, what are the things that are in your eyes, in your practice, unnecessary?
So it's interesting because I, again, kind of like applying this like one size does not fit all standard. It looks different for everybody. So midwives in California, we are licensed through the Medical Board of California. So we are held to the exact same standards as every other obstetrician. What that means is that we have to, at the bare minimum, provide the standard of care. So at the most, if I took my practice onto the most basic level, it's like, I have to offer genetic testing. I have to offer blood tests. I have to offer ultrasound. I have to offer like anything that is considered routine during pregnancy, I have to offer. Does everyone accept it? No. I have plenty of from clients who decline the genetic testing because it's not going to make a difference in their decision making. I have some people who want to limit their ultrasounds for various reasons. And it could be like maybe they had an ultrasound in a previous pregnancy and they got, they heard bad news that didn't end up being true. And it created so much fear in them that they just don't want to deal with that in any future pregnancies. Everyone comes to it differently. So the bare minimum I still have to provide everything that is considered the standard of care. I think the primary difference is, and this is what I hear from a lot of people who don't have their first pregnancies with me, but then come to me for their second or third or fourth. I think the difference is, rather than saying, you're going to show up for this appointment and I'm going to do a blood test on you, I say to you, hey, at this next appointment, the standard of care is a blood test. This is why we do it. This is what we're looking for. This might be the alternatives, right? And you can obviously decline it if you don't feel like you want to do it. And those are conversations that I feel like generally don't happen in your typical setting.
Because it doesn't feel like there is the option to decline. But really in Western medicine, you can decline it.
Decline anything.
But your doctor just won't like you for it.
I think we live in a world of like, why wouldn't you want to know? And we also the average OB appointment is 5 to 7 minutes long. We looked at just statistically, it's not a number I'm making up. 5 to 7 minutes is the amount of face-to-face time that you have with your doctor, right?
Yes.
Your vitals are taken before you walk in the room. Your doctor walks in the room. How are you feeling? How are you doing? They'll do a quick ultrasound or they'll listen to the baby's heartbeat. They'll ask you if you have any questions. And for a lot of women, that can feel like they're being put on the spot. I have heard many women say, well, I didn't want to bother my doctor. I didn't want to bother my pediatrician.
Right.
And so they don't ask the question, and then they'll consult with Google, or they're just being told what comes next. And so there really isn't that space to have that dialogue. You'd be hard pressed to find a midwife who does an appointment in under 30 minutes. And it's for that reason. It's like, we are creating the space and the time that you can bring any question under the sun. Yes, there are things that in any given appointment I might have to discuss. There are appointments where I don't really have anything to discuss. But so the time is really all yours to make of it what you want. But it creates the space in the environment where you feel safe asking the questions. You don't feel judged for your decisions.
That relationship for every day.
Right, because I think that if there was time for a woman to say to her doctor, I don't want to do genetic testing because it's not going to guide my decision making. I will carry this baby to term no matter what. That doctor's not going to hate you for that decision. They might actually understand that decision and say, oh, okay, well then what's the point? Why do it? Or they might challenge you back and say, but well, what if X, Y, and Z?
Right.
Listen, inevitably, we're always going to find out answers in one way or another.
Yeah, I think just the standard of care for Western medicine has been so normalized that coming to a midwife like sounds kooky. You know what I mean? Like it's not even like crunchy, I would say. It just sounds like there isn't the standard of care because we've been taught that this is the standard of care. And then you're over here saying you have the option. It's your choice. And now instinctively, we might understand that going through the Western medicine route, we have the choice to decline. But when everything is just offered in your face, it's so much harder to decline, especially when the norm is going with the curve and going with whatever the doctor is saying. And you might be the one going against the curve and saying, actually, I'd rather decline that test.
I think especially when you're I think that there's a place for Western medicine and there's a place for women who want to give birth within that system. Like I don't begrudge any woman for choosing the path that feels the most aligned for her, as long as they know there's options out there, right? I don't feel at all like I have no animosity or no hard feelings towards like
no, neither do I. And that's literally what I told you when I came to you. I was like, I am not here because I want to be here. I am here because I have adverse reactions to the epidural.
Right.
If I could get it and my body would react well to it, I would take it. My body doesn't. And if I go to the hospital, I am the type of person that I will just tell them, do it.
Yeah.
And that's literally like that was my mantra. Like while I was meeting with you when I was pregnant with my fourth, I was like, this is why I'm here. There is no other reason why I'm here.
I think what I've seen too often is like the use of kind of negative outcomes to pressure people into making decisions that align with what they want to do.
Yes, it's the fear mongering.
It is. We call it pulling the dead baby card. And it's unfortunate that, and again, I don't spend a ton of time in the hospital, but if I've seen it played numerous times, then I know it gets played often.
Right. So 99% of the time when you're hired, you're going to people's houses.
Yeah.
You're not assisting them in the hospital.
Every so often, I always joke that I like to do 1 or 2 hospital births a year because it keeps me humble in terms of like it even in the best hospital birth, like it's just so different than the home environment and don't get me wrong, the last hospital birth I assisted at was absolutely beautiful. Like it was beautiful, it was wonderful, but it's just a different energy. And so it reminds me why I do what I do and why I offer what I offer. But again, I think that there is a place for this level of care with someone who's still planning a hospital birth or needs a hospital birth. Some people, they need to go to the hospital. Right. For one reason or another, whether it's a pre-existing condition, whether it's a specific case with this pregnancy, whether, they need the hospital. It's just that.
And you determine that based on their history when they come to you.
Yeah. And then some people want it. Right. Like I have a hospital birth coming up this summer and it's because that's where she wants to give birth, but she wants this level of care. She wants to talk through these decisions. She wants someone who can listen to her baby and check her at home while she's laboring. And then we'll go to the hospital when she's ready to deliver.
Right. Yeah. So what would you say are things that are common fears or doubts that clients come to you about your abilities? Not saying you're not capable,
no.
just like, because people hear midwife and then they
think we burn incense and
pray
over your belly and pray over your belly.
Yes.
No, even my husband, when I told him I wanted to work with a midwife, he's like, in the biblical sense, like, what does that mean? Like, what? What does a midwife do today? I think there's comment. I think the number one thing I hear is like, how are you different than a doula? And this isn't usually people who are coming to me who are seeking out this level of care. I feel like most of those people are already like well informed on what we do. But I think like if I was just looking at the general population, what's the difference between what you do and what a doula does? And it's totally different. I have a medical license. A doula is a necessary component of any birth. They're so wonderful, but there's no medical training and they don't do anything medical. I think, I mean, if it was, again, just kind of looking at the general population, I think because of that, because people don't understand the differences, I think a lot of people think that midwives are not medical care providers. And like, again, here in California, we're very much ingrained within the medical community. Like we have to get our licenses through the medical board. We have to test into that process. Like there's standardized education systems here that we have to follow kind of all those steps to become licensed here, which I will say is not formulated across all states, but in California we have.
Do you have to do continued education credits as well? Okay.
We have to recertify neonatal resuscitation and basic life. So the ability to resuscitate newborns and then basic life support every 2 years. We have to reapply for our licenses every 2 years. And that includes all the continuing education units that we have to take over the course of that. We have to meet in peer review, so like discuss our cases 4 times a year. You have to attend at least, I think it's 4 times a year. So there's things that we have to do to keep up our licenses. So I think probably the most common misconception is like we don't necessarily like have the medical skills that we do have. When it comes to like those skills, like
well, there's beyond the birth too, right? So I think that like when I hear people's concerns, it's like beyond the birth. Like, okay, I'm not saying getting the baby out isn't a hard thing, but beyond the birth, like the cord clamping, cutting of the cord, weighing, APGAR scores, checking the baby's vitals, checking the mom's vitals, if there's clots, if there's hemorrhaging, if there's stitching involved, like all of those things sounds to somebody who doesn't know what the standard of care is for a midwife, sounds like only something a doctor could do.
Yeah. And so we actually do all those things. So we carry drugs to stop hemorrhages. We have oxygen if for some reason it was needed for mom or baby. We have antibiotics, IV fluids, any type of resuscitative equipment needed for a baby. We have skills in terms of resolving shoulder dystocias, which I actually feel like in an out of hospital setting, we do even better than they do in the hospital because we're dealing with an 100% unmedicated population. So like when we have stuffed babies, it's so much easier to get that out of a mom who's mobile as opposed to a mom who's on an epidural. We are, it's within our scope to deal with normal newborn care. So we're able to, assess and treat babies, or rather evaluate babies up to 6 to 8 weeks postpartum. We refer out obviously for anything that needed a referral. So, right. The rare occasions that I've come across, like a heart murmur, for instance, I refer obviously to a pediatrician who then will refer on to a cardiologist for things like that, but we are trained to identify them. And then we're also, because we are so well skilled in like normal birth and I mean normal low risk. That's yes. what I mean. We are so skilled in dealing with like low risk birth and low risk newborns. I feel like when, the first time I heard a heart murmur, for instance, it was like, whoa, that's different because right. I'm so used to dealing
You're
with
used
low
to the
risk
standard, so
that it jumps out the second you see it.
Right.
But yes, we can manage hemorrhages at home. And then again, I mean, taking care of newborns for the first 6 to 8 weeks. I will say, generally, it doesn't stop there. Like my clients text me about all kinds of things all the time. I think that, again, I think that there's always this hesitation for whatever reason to like, I don't want to bother my doctor. So what do you think about this? And so I like to say midwifery care is like life.
Right. Well, also because it's just easier access. Like as your client, we have your cell phone number.
Yeah.
So it's just a lot of easier access. How do you manage being on call with 3 kids? I mean, now your kids are a little bit older, but that recently happened. But like you've been doing this for 9+ years. So for the majority of the time that you've been doing on call, it's been while they've been younger. And most women, I mean, correct me if I'm wrong, but from what I understand, go into labor at night because the stress relaxes and the body goes into a relaxed state. So labor can start at night most commonly.
Yeah, I feel like my night births are actually some of my easiest because everyone's just sleeping. You're out the door. And there have been times where I'm out the door after everyone's asleep and I'm home before everyone's awake. I am so lucky to live a few blocks from my in-laws. I have to be honest that without that kind of community or familial support, it would be so much more challenging. So it's really like my nod to them because they are so, so helpful. But then my husband also, I think there was an understanding. I had a conversation with him before I like fully agreed to go to midwifery school because, I had read some things just about like midwives and marriages and how that can affect those relationships because it is challenging to support a person in like achieving their dreams, but like knowing that.
But also your schedule's all over the place. You're unpredictable.
Yes. And I think as a student, it was definitely the hardest period because it wasn't even like, you're not even making money. You're just like, you're a student and you're apprenticing. And so you're showing up to births and like, that was definitely a way more challenging time. My kids have essentially just grown up into this life. And so like, even, my youngest who's 5.5, like he was born when I was a midwife. I had a full practice. He attended a birth with me when he was a month old.
Wow.
He attended a few births with me. There are times where it can be really challenging. I will say that like now having lived this life for 9.5 years, it just like, it is what it is for me. And so like in any given day, like I don't think about it that much in terms of like, oh my gosh, what if we're at Disneyland and someone goes, it's like, yes, it's kind of always in the back of my mind and I'm always kind of game planning it. But when you take 4 to 5 people in a month, that's 4 births you're going to attend potentially over a 4-week period that can happen at any point in time. I just kind of live my life until someone calls me and tells me that something's happening.
Right.
And then thankfully, like I have a really understanding carpool who's like, yep, I got it today. Or in-laws who are like, don't worry, I got it. Wow. And a husband who's like, don't worry, I got it. And so it all works.
Wow. So when do you sleep?
All the time, actually. One, go to bed. If you know me, you know that like do not disturb is on at 8:30 at night. I'm like, don't text me after that time. I sleep all the time. Yeah. Plenty. Yes, some births happen at night, but some also happen during the day. My last two were like, one was a 7:30 a.m. wake up call, and one was a 4:45 a.m. wake up call. So if you go to bed at 9, it's not so bad.
Right. Have you ever missed a phone call?
I've never missed a phone call. I have not made it to a birth that was just like moving so fast I didn't get there on time.
Right.
Yeah.
That's crazy.
Yeah.
And then, so how does it work with Shabbos and like being invited out and having guests over?
Guests over is so much harder because my husband is like, for every bit of extroverted I am, my husband is more introverted. And so unless it's like someone that we know well, that he would be like happy to entertain, that would be a challenge. Like if I get called out on Shabbat where we had people over, it would be very hard on him.
Right.
And then
it's like taking them out and be like, hey, I'm going for birth. Let's bench and go.
Going to people's houses. So I carry my phone on Shabbat. I have to. And going to people's houses, like there have been times where, you know, someone was in early labor and they didn't necessarily need me right away. And so like, I'll go and I'll just plan to leave if I have to.
Right.
Yeah.
No, that's insane.
But I also like, I've gotten to the point where I also like, I set boundaries when I need to. So, you know, my son is graduating from middle school this year and it's like his graduation is on a Tuesday night. And I have told everyone that is due around that time, like from 5 to 10 p.m.
I'm not available.
I'm not available. If someone is pushing out their baby at 5 o'clock, like I'll have my clothes in the car and I'll go straight there. But it's like, I cannot miss that. And I will not miss it.
Right.
And so, you know, I've also like set those boundaries in place now because it's like
So what happens in that instance? Your assistant, your partner will go in your place.
So the midwife that I share an office, I mean, I'm so fortunate that I have this, you know, tight community of providers and doulas, and we're all such good friends and we all back each other up. And so, you know, before I tell anybody else I'm taking this time off, I text the other midwife and I'm like, hey, can you cover me for this 5-hour period? And I do the same for her. Like she's having, you know, she needs to have a very minor procedure done. And so like, I'm going to cover for her for 2 days. It's like, we back each other up in that regard.
Yeah. So what is the difference between a doula and a midwife? And why would somebody, if you're coming with you and an assistant and maybe the other midwife in the practice, if she's available, but you sometimes recommend to clients to hire a doula. First of all, what gives you that into maybe that client would want a doula, or maybe this client would be fine without a doula? Mm-hmm. And what is the benefit to that client having a doula?
Yeah. As a general rule, I think that all first-time moms and all moms who are having their first unmedicated birth should consider a doula. The reason is because as the medical team, we come when like labor is more well established. So a doula can come at any point in time. Truly, like a good doula, no one should really call their doula with their first contraction, but like a good doula will say to you, I'll come as soon as you need me. And for everyone that could look so different, you know, we don't know how long someone's labor is going to be. So oftentimes doulas will be there for longer than we are. More often than not, especially with first-time moms, they're there before we are. And they are your physical support person. I mean, they're the ones they're going to squeeze your hips, they're going to massage your back, they're going to rub your hair. Some women don't want any touch during labor, so they're also just going to be there as like an emotional support person. You know, a well-trained doula has seen hundreds, if not thousands of births. And so for her, it's like she knows exactly how to focus and center a woman who needs that emotional support. And they're non-medically trained, but they logistically, because they're generally like they've experienced many births, they can tell where a woman is roughly at in her labor. So when it comes to like the logistical side of things, like when should I call the midwife? When should we set up the tub? When should we like prep things? Like she also kind of she's that point person. So, I mean, it obviously benefits the woman to have those levels of support. I myself had a doula at all of my births, and I don't think I would ever like not have one. I mean, I can talk myself off a ledge, but like when I need someone to squeeze my hips, I need someone to squeeze my hips, and that I can't do myself. Right. But I also count a lot of doulas as friends.
So just to give an understanding, squeezing of the hips opens up the pelvis and allows the baby to descend further down.
It's counter pressure against expanding hips. Especially as our babies, like second and third babies, they're descending into our pelvis somewhat rapidly. That counter pressure just kind of eases that pain, which allows us to relax into it, which then allows the baby to come down. Because if you're tensing, you're just holding your baby in. Having that counter pressure allows us to relax a little bit better, which is allow our babies to come down. But doulas are, I mean, they're worth their weight in gold. I love doing births with doulas. I count doulas as some of like my best friends, but that is the primary difference is they're just not medically trained. So they're certified. They know how to read the labor pattern really well, but they don't provide any medical assistance.
Like they're not assisting you in the actual part of the birth because they're not allowed to legally.
Correct. Sometimes I might have them press a button on the computer if I have no one else there to help me. But other than that,
For charting purposes. Right.
or if like I need them to hand me something if no one else is there. But sometimes things just happen that fast and they're the only other hands on
Right.
Yeah.
Right. Okay, now we're going to get into the nitty gritty for a second.
Gosh, what?
We're going to talk about price. I'm not going to say the price, but a common question is how do you, I don't want to say justify because that implies that it's not worth the cost. So it's not that, but that's the word that's coming to my mind. But when somebody sees a lump sum versus copays throughout 9 months and then a hospital bill, that's hard to comprehend. How do you explain it to the clients? How does it work? Is there insurance involved? Is there no insurance involved? Kind of walk somebody through that process.
Yeah. I mean, I think like, again, for kind of all the reasons that we like talked about already beforehand, you know, I will say that there seems to be quite a big shift in this direction. I will say that because more and more doctors are actually now charging concierge fees on top of as part of their practices. So we are seeing a shift in that direction. So when you look at it, when you take the concierge fee plus what they bill insurance, plus what they get paid for the birth, it's like they're actually probably making more than we are and we're spending more time with you. But that's now just started because prior to that,
it wasn't just starting because my OB started this, I want to say 7 years ago.
But they're getting higher.
They are getting higher.
Now they're much higher.
So now what's happening in their office is in order to have your first scan or your first OB appointment, which is generally by them at 8 weeks, you pay $750 as like I'm locked into this practice. And then there's a concierge fee for the pregnancy should you want to lock in this specific doctor for your birth. And then on that form that you sign, if that's what you choose, which is $3,000, there's a clause that says the doctor might not be available if it's not the day that he's on call, or he might be out of town, or she might not be here. Should that happen, write down your number 2. Okay, now write down your number 3. I'm like, so we're basically just going through the list of the practice here.
And you pay the concierge, you pay the $3,000 concierge fee to lock in your doctor. No, but if you did, you're locking in your doctor, but there's still a clause that says that your doctor might go on vacation?
Yeah. No, not go on vacation, that they might not be there for if it's not their day on call or whatever it is, or if like another doctor is doing a rotation because they each have their day in the hospital, they might not be there.
So what do you get for the $3,000?
Literally nothing. And you don't have to pay that. Yes. Yeah. But you don't have to pay that fee. Rotation. But then I remember being at the appointment and like reading this paper and I was like, I looked at my doctor because he was in the room when I was looking at the paper and I was like, you're joking, right? He's like, what? I'm like, no. And he looked at me and I was like, look, I love you, but I've seen all the doctors in this practice. Like whoever is going to be on rotation that day is totally fine with me.
So they're coming in for 10 minutes.
Ironically, he was there on rotation and I was delivering my son. It was COVID and it was getting close to 5 o'clock. And that's when his shift ended at the hospital. And so he wanted to give me Pitocin to speed me up. And I was like, look, if you got to go, please be my guest. Like, please go. Like, if you're worried about 5 o'clock coming around, like you can go. Like whoever is next on shift is more than welcome to deliver me. Like I'm okay. Like at this point, sorry, but everybody in the hospital has seen my parts. Like there's been a whole show in here. So like at this point, the next person who comes in isn't that special. And he started laughing. And then 20 minutes later, my son was born at 4:21. But I was just like so happy that I didn't fall to the like concierge fee BS because I was like, it literally says on the paper that they're not even guaranteeing that that doctor will be there.
So I think, so like so take the person though, who's like, I want this doctor, right? Because this doctor is more friendly towards unmedicated birth. They're less likely to induce me. And like, you know, take the person who has like a birth
they have
plan.
A history with you and they've delivered all your other babies and there's that connection or you feel like that they go above the standard of care for you. Whatever it is, whatever works for everybody. But for me, when I saw that thing on the paper, I was like, no.
Right. But so I think, so we are seeing kind of that like shift now towards like what is, you know, more like a concierge level care or rather concierge fee, but like what do you get within that fee? Like you said, it's like maybe your doctor's there, maybe your doctor's not. So built in essentially to that like all encompassing fee is like all of your appointments are going to be with me, and they're long appointments. They're 45 minutes to an hour long. Like you're just seeing me. I'm going to do all your care in office. So like all your labs are going to be drawn. I don't do high level ultrasounds in office, but most doctors don't do them either anymore. Like we send to maternal fetal medicine specialists and they do them. And everything else, it's like,
but you do have a machine if a woman wants it.
If I'm like 99% sure a baby's head down, but I want to be 100% sure, I can look with an ultrasound. I can check, you know, early on in pregnancy to make sure there's a heartbeat, and it's not twins. And but so everything is done kind of in house. And then when it comes to the actual
twins considered high risk?
Yeah.
And so you can't do that for a home birth?
Not by myself. If an OB is there, we can do it.
And what has an OB, have you ever delivered twins? An OB, has it come to assist you? That's so cool.
Twins and breeches.
Wow. Well, breech is not really happening anymore because a doctor who's unnamed is not practicing anymore.
Right, but we can do breeches at home with the doctor present. So I've done breeches at home with the doctor present.
Okay. Yeah. So you're medically obligated for twins and for breech births to have a doctor present.
Twins, breeches prior to 37 weeks, although we don't ever usually do that. And then after 42 weeks, Those are like the major
ones. Okay. And then what does pain management look like during birth? Because you don't have access to epidural hip squeezes.
Hip squeezes water. Hip squeezes water. I mean, again, I think a lot of it is also just like
the environment.
Yeah, the environment itself, but then also like focusing a woman. I think any of us have been in like a stressful situation and we're just like, breathe.
Yeah.
And you start breathing and it like relaxes and calms your entire body. And so much.
I vividly remember. And I remember also that I couldn't open my eyes because I knew that my husband was standing over me and he was davening, but I knew that he was nervous. And I get it. Like I was nervous too, but also you're hearing your wife in pain and there's literally nothing you can do.
So one of the things that will never cease to like fascinate me, and I'll say this about you, but I'll say this, and you can cut out whatever you don't want like out there, but I'll say this about you. I also like one of my very dear friends had her first baby with me, and like had her first baby. I went with her to the hospital, but our interpretations of her labor could not be more different. And I think it's just the difference between the internal dialogue and what's happening inside the body and what we see from the outside. Your labor was beautiful. Like in my head,
I have no doubt.
But when you talk about like being nervous or being scared, or even like how he's seeing you in pain, it's like what I saw was like someone who was, had I not known.
You don't think he was nervous?
Had I not known, I would not have thought that was your first unmedicated birth.
Wow.
I wouldn't, I told you this right afterwards.
I mean, it's not me, it's really Hashem. And I remember saying that like a lot of times. I remember saying like, Hashem, please help me. Like, please help me. Like, I felt like it was so beyond me that it wasn't something that was going to come from my own strength. It was something that I really I wouldn't say like, oh, I felt God. Like, no, it wasn't that. It was
your husband.
I'm sure he did, but he wasn't the one pushing a child out of him, but like, it was more that I knew in that same way that you say that a woman knows how to move her body instinctively and how to, like, sometimes in those contractions, like I was stuck because it's just paralyzing in those moments. And like the way that he was coming down, like I couldn't reposition myself. And I had to be talked down in those moments of like, okay, calm down. Like you're going to be okay, but I think that in the same way that a woman knows how to instinctively move her body, there's this state that I got into that was like, this is beyond me. And there's literally nothing that I can do.
No.
Nothing. I can't speed up the process. I can't slow it down. There is nothing that I can do that will change what is happening right now. And it is painful. But I will say that, like, going back to what I said earlier, it wasn't a crunchy decision. It was more of like, I had 3 kids at the time. I was having my 4th. I did not want to deal with packing them up. I didn't want to deal with like the logistics of like school and extracurriculars and carpools and this. We knew I was having a boy. So like all the like things behind having a boy and the bris and then the mole coming to check. And like, I was just like, there's just so much things happening. My parents came, they got the flu literally like 2 days before I delivered, which was a whole other thing. For me, it was like the postpartum care when I had my 3rd he was he was during the second surge of COVID. So in January 2021 was like the second surge. And I got COVID when I was 8 months pregnant with him. And he was born 2022. He was born February 2022. And thank God I didn't have to wear a mask because I had COVID a month before. So I was in like the 30 days and they were like, okay, great. It was only me and Lenny allowed in the room, which that was fine. But the postpartum, they switched the ward in Cedars. So the rooms were tiny. The showers were tiny. The nurses were barely coming in to help. Like it was just this moment of like, there's nobody here to help me. Like, and my husband is going home to be with the other children as he should. But like, I'm literally here and I can't do anything. And I'm here with the baby and you're asking the nurses for help. And I'm like, sorry, we can't do that. Sorry, we can't do that. COVID. And I'm like, what am I going back to?
Right.
To take a shower with a towel that covers half of my body. Like, and it's freezing cold and the water pressure sucks. So for me, it was more like, that was honestly in my mind. Like as I was laboring, I was like, I got to take a shower soon in my shower. I got to take a shower soon in my shower. And that was like one of the first things I asked you. I'm like, can I please go shower now? And you're like, no, you can't. Not right now. And I was like, please, I feel gross. Like I need to go shower. And you're like, you need to lay down like for a little bit longer. But I think that like, for me, those were the incentives of like, yes, it was chaotic and it was crazy. And there was a lot going on in the mornings with my kids and the afternoons with my kids, as it is with little kids. But going to the hospital for 24 hours seemed like a lot more of a to-do and like meshagas, if you will, than staying home and laboring, which I know sounds crazy to a lot of people. But like, to me, that was the upside to me. It wasn't like no medication. It wasn't like this. I'm like, literally, like if you could find a way to find me pain meds, like I was like, I'll take them.
But I think you're touching on something so like important too. It's like we all have our whys, like, and your why doesn't have to be my why. And it's the same thing. Like I'm sure you've known someone who like scheduled a C-section for like a matter of convenience or a scheduling issue or something, or even an induction. People schedule inductions all the time for things that like, you know, for things they want to control. And so like for us, we want to control the setting. We want to control like what happens immediately afterwards. And that's okay. Like that's our why.
Yeah. Would you say that in the recent years, because I didn't know of you and then somebody told me about you, we're not in the same community, but she found out about you and she told me about you and I reached out to you. And then I think like 2 weeks later, maybe after we first met, like you were added onto the show chat. Oh. And I was like, oh, we go to the same show now. Okay, cool. But would you say that recently you've shifted into more from clients and beforehand, like your clientele was more either not from or not Jewish?
Yeah. So there has always, for the last like 20 some odd years, there has been a midwife that kind of sits like right outside our community. So right outside Beverlywood and right, like, I mean, we're in the, what do we call it? Crestview, like Los Angeles area. So there's been a midwife who is right there. And so she's always, I always felt like, especially because I was building a practice, I always felt like, okay, she was the midwife that like, no, talking about Davey.
Okay.
Yeah. That so I always felt like she was the one who like most people knew about, went to, because she was just like right there.
Right.
But definitely over the course of the last few years, I've seen an uptick. And it's not just actually in our community, it's also like in the Valley. I think October 7th and kind of like a rise in anti-Semitism that actually followed. What I started to see, interestingly, was women who were seeking out providers that could relate to them during a very challenging time. Yeah. I really had to point to like a turning point in when I saw like a shift in how many Jewish.
You wouldn't say it was after COVID?
No. I hadn't. No, I've always had a very, very steady clientele, and there was an increase in demand for home birth after COVID. But if I was going to look at like what increased my Jewish clientele, it was
interesting.
And it wasn't just like, I have a good friend of mine who's a doula who she is not Jewish, but super empathetic and just like very loving. And, like because she's a good friend of mine, she kind of saw like sort of the emotional turmoil that I was going through during when that, after October 7th. And she was approached by a Persian client who said, I need to know something because, there's been a rise in anti-Semitism and, this happened to my community. And I need to know that you don't feel certain things, like you don't align politically with like movements that I wouldn't feel safe if you supported me.
Right.
And when she said that to me, it was like, she was like, one, she was heartbroken. In the sense that like, that someone that a Jewish woman had to consider that before she hired someone. She's like,
because it goes back to what you're saying of the energy in the room, the environment, that is very intrinsic in birth. And so it may not be spoken, but there is a feeling there. And if she needs to do that to clear the air, to know that she's going to be okay. With something also that I had to say to Lenny before I delivered Mimi, which I won't say here because I'll spare everybody. But literally after I said that, I was able to push him out. But like, you have to be able to just let that go. And it's sad. It's sad that it's something that we have to consider, or even certain things of like, oh yeah, I'm not going to put the name down yet because, 8 days or whatever. And you kind of get like whatever it is, like,
or even I had someone who their son's middle name was Israel, but they didn't want to put it on
the birth certificate.
They didn't want to put it on the birth certificate or because they didn't want it to show up on the kid's passport. But I do feel like that seemingly was a shift. And I think other Jewish providers would probably say the same thing, that there seemed to be an increase in demand essentially for Jewish women to feel connected with their providers on a different level. We were all, for years afterwards, really struggling as a community and like really, not seeing the rise in anti-Semitism, seeing the rise of vitriol towards Israel and things that are really important to us. And so I actually do feel like that was a major turning point towards like, oh, you're Jewish? Okay. So I want to go to you because you understand me on a different level.
Yeah.
And it's also like, obviously, like, look,
culturally, you also understand.
100%.
So
I will say it's never the same, like in terms of like what people, how people treat their specific birth experiences. I have husbands in the room. I have husbands out of the room. It's like, their level of where is different. And so like, I still like, but it's not, these are obviously like, people don't have to explain things to me that the way they might have to explain things to a non-Jewish midwife, or even just like, in terms of like what would be considered appropriate dress when I show up to someone's house giving birth. It's like, my team knows that if I have a firm client, like, you are coming covered. You know what I mean? Like, I think, yes, they're not in long skirts. Like, it's not that, but rather it's like, we're not wearing low cut shirts. We're not showing up in jean shorts,
Right.
Like, but some midwives do.
Right. Which is, again, that's fine. And that depends on your personality and if you care about that or you don't care about that. And I think that it adds that nuance, that extra added level of care to not have to go through that and to not have to explain, like, if you had to, like, if a client had to explain, like, on Shabbat or on holiday, or this is Passover, and then we have these intermediate days, which means that, like, it's too much.
Even like, I'm only going to call you one time to like let you know I'm in labor.
Right.
It's like sometimes, especially in a world of like constant contact, we expect like updates, periodic updates. So it's like, even just like understanding, like, you may not get a single update and you may only get the call that says like, you have to come now, like, I get that. And there's a lot of things, or even just like Nita, trying to explain Nita to people. And like, my husband's just not going to touch me in labor. Some people are going to be like, what do you mean he's not going to support you? Like, you're pushing out his child. It's like, no, it's
right.
It's fine. And we're also used to that. Like, as women who practice Nita, it's like, we've been through challenging times in our lives where our husband couldn't.
Wrong, because Nita or not, or Jewish or not, let's put it that way, there are some women that, like you said earlier, just don't want to be touched during birth.
Yeah.
So like, it has nothing to do with, it might be that the woman is Nita, right? It's once you have a bloody show that labels you as Nita when you're in birth, but she might not want that touch anyways.
But I think also, I remember when I was doing my college classes years ago, decades ago, feels like, one of the things that the Rebbetzin said to me that she found was so beautiful about like the period of being in Nita was that you had to learn a different level of communication with your partner, right?
Yes.
You could be experiencing the most traumatic thing in your life. You could be grieving of the loss of someone, and you are in Nita. Your partner has to learn how to support you simply by talking to you and connecting with you differently than, on a non-physical level. So I also think, like, for those of us who have practicing it for a lot, like, we understand, we have those basic levels of communication to be able to comfort someone without physically touching them.
Yeah. And it's definitely an interesting period post-birth because you've just gone through 9 months of no menstruation, no bleeding, no Nita. And then all of a sudden you're like, wait, I have to like put the baby down on the bed, and then you have to lift him up. And then like you forget, I'm like, okay, whatever. Like, it's fine, But it is very interesting. But I do also want to speak to the postpartum of newborn care.
Mhm.
And once the baby is born, you're there for a few hours. Then there's the 24-hour period that you come back and you do the newborn screening.
Yeah. So in home birth, we offer everything essentially that they do at the hospital. So if you want IOM, we do IOM. If you want vitamin K, we do vitamin K. The only thing I don't do at home is the hepatitis B vaccine, but anybody can get that administered whenever
when they go to their
visit their pediatrician. And then when I come back, I do a cardiac defect screening and the newborn screen, which are the two tests that are typically done before a woman is discharged, before a baby is discharged home from the hospital.
Right. And then then up until 6 weeks, you're not just seeing the woman at the 6-week appointment. You're there for a few hours after the birth.
Yep.
You're hanging out. Then 24 hours later, then usually again within that week.
Come between day 7 and day 10, essentially. And then I see you again at 3 weeks and then again at 6 weeks.
Yeah. So it's a little bit more hands-on in terms of the postpartum care. And I find that those points are interesting because the 24-hour mark, the adrenaline has kind of gone down, but it's more than just the newborn screening. Then the 7 to 10 day, if it's a boy, then it's usually either before the bris or after the bris, sometimes both, depending. And then the 3-week mark is like when the dust settles. Not that the excitement is gone, but like all of the like hurrah from everybody around is done. And if people are from out of town visiting or out of town from helping or whatever it is, like all of a sudden, like kind of life resumes to normal. The meal train is kind of coming to an end. And that's when I find psychologically that a lot of women start getting the baby blues, the milk comes into like it's maturing, and deemer comes, the depression, letdown, and all of that stuff comes in. And as a midwife, you come in and you can sense that and you can gauge that and you can have those conversations because you're coming in at the 3 week. But when you're in the standard of care of Western medicine, you're waiting till 6 weeks and you might have either given up, you might have already been suffering with intrusive thoughts or whatever.
You go in for your 6 weeks and you're given a checklist, and that checklist is meant to determine whether you have postpartum depression or not.
Checklist and a green light, and you're like,
So in my practice, I actually have a 0% basically postpartum depression rate within the first 6 weeks, meaning that like I've never hospitalized anyone, I've never had to put anybody on meds. It doesn't mean that postpartum anxiety hasn't crept in,
but usually it's later.
But
if it happens,
the 2 cases of true postpartum depression I had actually started with a return to work at 4 months.
Oh wow,
very interesting. But it was like in both cases, and again, both times they were technically outside the scope of my care. I was the first person they called.
Wow.
And I think it speaks to sort of the relationship that I built with them over the course of those months.
Yeah.
And in some cases it was years because I had seen those women for previous pregnancies as well. Yeah. But I was the first person they reached out to when and in one case, I mean, things were well advanced, meaning that like it had kind of spiraled very quickly in terms of like going from like, I'm starting to feel depression.
It can, because you're not even aware of it. The lack of sleep is sometimes huge. The shift in the hormones, either the hormone drop, the hormone rise.
We're also taught that like
body changes, or also like even like don't leave the house for 40 days, don't socialize, don't this, don't that. But like for some person, I'll say for my personality type, I can't not do that. And if that means that I look crazy taking a 7-day-old baby out of the house to go have a coffee at Lamalo with a friend, and I might pay the price and be exhausted the rest of the day, but like I need that for my mental health.
I actually don't ascribe to 40 days in the bed. I even actually I tell people all the time, like mentally, you need that walk. Like you need to go outside. You need to be outside for 10, 15 minutes. Like you don't have to go far, but like
don't call 2 weeks post and ask her if you could take a 40-minute walk to a Shabbos meal. No. She'll tell you no.
I will have feelings about that.
Yes.
But I definitely think like 7 to 10 days, like going outside for 10 to 15 minutes, getting the sun on your face, like it matters so much. Also, like, who am I? The same way that I am not the authority on like how a woman is going to handle things during her pregnancy or how she's going to handle things during her labor. Yeah. I am not the authority on how a woman is going to handle things postpartum. But I find from a physical standpoint as well, we heal better when we're more mobile. So like 7 days of like really kind of resting and chilling and being home is super important. But after that point,
it's okay to go for a walk.
It's not
okay
just that our bodies perfuse better
Right.
when we're upright. So like when it comes to like vaginal healing, for instance, I find that we heal better when we start. So when your foot is broken or when your foot is injured, stay off your foot. Okay, but when our vagina is broken after birth, we just sit on it all day. That's not going to heal it.
Right.
So I actually find that like getting up and moving around, I see significantly better healing or like a shift in the trajectory of their healing once they're off that area a little bit more.
But because it's all collaborative, right? Mental, physical, emotional. It's all collaborative. And I think that to just bring it away from home birth for a second, there are other things that you do in the GYN space that people wouldn't necessarily know, right? Or am I wrong?
Meaning what?
Like pap smears?
Mm-hmm.
And that's
best pap smear you'll ever have.
And that's, but I'm saying like, you don't have to like, there's other things, but really it's your main thing is midwifery.
Yeah. So I do offer pap smears. I do offer preconception counseling because I think sometimes it's like, especially if someone's shifting off birth control, if they have longer cycles that just need a little bit more like evaluating. It's actually, preconception counseling is actually one of my favorite things. It feels like a puzzle you're trying to figure out and like put together.
Wow.
But very rarely do I think people seek out midwives for that. Because you kind of have to be on like the earlier stages. I feel like once people are 6 to 12 months into trying, like they're going
more to a specialist
towards like fertility. But when you could get in with someone kind of on the earlier side, sometimes it's just a matter of like using supplements or different things to kind of like tweak things here and there, because we're really not given the baseline education about our bodies from an early age. Like so few women understand, like we're taught that the standard is you have a 28-day cycle. I mean, we base someone's due date off a 28-day cycle.
Right. But not everybody has a 28-day cycle.
Or someone like me, for instance, I have a 28 to 29-day cycle, but I ovulate on day 16 to 17 of my cycle, which is fine. But the assumption is that I'm ovulating on day 14 because I have this perfect length cycle. But what I learned through trying to conceive my first was like, no, that's not how my body works. I ovulate 2 to 3 days later than anyone would anticipate. But let's say you're someone who ovulates on day 20 of your cycle and you have a 28-day cycle. We have to fix that. There isn't enough time for an egg to implant and for the lining to build up for that pregnancy to work. And so it's even just like looking at things like that and educating women on like, what are the signs that your body's ovulating? How do we know these things? And so there's so much that can be done on the preconception side before like someone makes the jump to the fertility treatments. And again, not that there's anything wrong with people that need that, but fertility treatments, it's a lot on your body. And if it's a matter of just like looking at a cycle and saying, hey, these are ways that we can shift things to hopefully lengthen this period of time or change, like that should be a starting point. It's just a more holistic or natural way to kind of look at things. So yeah.
Amazing. Well, thank you, Abby.
Of course.
Coming. This was awesome. I hope that whoever is listening got some into what a home birth can be. If you have any other questions or you're curious, reach out to Abby. You can find her on Instagram at LA Midwife Abby. And this was great.
So fun.